Despite strong evidence supporting the safety and effectiveness of flu and HPV vaccines, questions and misconceptions still arise in clinical conversations. In this video, we'll address common concerns like safety, side effects, and effectiveness, and provide clear, evidence-based answers to help you feel informed and reassured. Let's start with the HPV vaccine. The human papillomavirus, or HPV vaccine, was licensed in 2006 to prevent HPV infections and the cancers it can cause. The initial vaccine protected against 4 HPV types, while today's version protects against 9. With on-time vaccination, about 90% of HPV-related cancers can be prevented. Research shows that the vaccine significantly reduces the risk of developing HPV-related cancers by about 54% among boys and 30% among girls, and cervical cancer deaths in young women have dropped by 62%, likely due to widespread HPV vaccination. Before being licensed, the HPV vaccine underwent rigorous safety testing in clinical trials involving more than 15,000 people, and it continues to be closely monitored today. To date, no new safety concerns have been identified. In fact, more than 100 studies involving over 2.5 million individuals across multiple countries have confirmed the vaccine's strong safety profile, showing no serious side effects beyond those expected with other routine vaccines, such as allergic reactions or fainting. With this strong safety profile, healthcare providers can confidently recommend HPV vaccination as a safe and effective cancer prevention tool. Still, some parents may have questions, especially about side effects or whether the vaccine could impact fertility. These concerns often trace back to a 2012 case series describing 6 girls who developed primary ovarian insufficiency, or POI, between 8 months and 2 years after vaccination. However, this report was based on very limited evidence. Large, well-designed studies published in 2018 and 2021, including nearly 1.2 million women, found no link between HPV vaccination and POI. It's important to remember that HPV infection itself can affect fertility, both through the disease and the treatments required for HPV-related cancers. By preventing infection, HPV vaccination actually helps protect fertility for both women and men. Some parents express concern that vaccinating preteens against a sexually transmitted infection might encourage early sexual activity. Others believe that if their child isn't yet sexually active, the HPV vaccine isn't necessary. It's important to emphasize that the HPV vaccine is preventive. It works best when given before any exposure to the virus. That's why the American Cancer Society and the American Academy of Pediatrics recommend vaccination for all children between ages 9 and 12. Starting the series at age 9 allows more time to complete it on schedule and helps shift the conversation away from sexual activity, focusing instead on long-term cancer prevention. For parents worried that vaccination might change sexual behavior, research offers reassurance. A 2012 study involving more than 1,300 girls found no differences in rates of pregnancy, sexually transmitted infections, or contraceptive counseling between those who were vaccinated and those who weren't, showing that HPV vaccination does not lead to earlier or riskier sexual activity. Finally, it's worth noting that numerous studies have shown that healthcare providers cannot accurately predict which patients are or will become sexually active. For that reason, sexual activity should never be used to determine HPV vaccination eligibility or timing. Every child deserves the protection this vaccine provides. Because the HPV vaccine is often associated with preventing cervical cancer, some parents may wonder why boys need to be vaccinated too. The answer is simple. HPV doesn't just cause cervical cancer. It can also lead to cancers of the mouth and throat, penis, anus, vulva, and vagina. In fact, about 4 out of every 10 HPV-related cancers occur in men, and the most common HPV-related cancer in the United States is oropharyngeal cancer, a cancer of the throat, in men. By vaccinating boys, we're not only protecting them from serious HPV-related diseases, but we're also helping reduce the overall spread of the virus, providing protection for everyone in the community. Some parents believe their child doesn't need the HPV vaccine because they plan to wait until marriage to have sex. While that value is deeply respected, it's important to remember that HPV is extremely common. Nearly everyone who is sexually active will be exposed at some point in their lives. Even one future partner could unknowingly transmit the virus, as most people with HPV don't know they're infected. Because the vaccine works only before exposure, vaccinating during preteen years offers the best protection, no matter what choices a child makes later in life. It's about safeguarding their future health, not making assumptions about their behavior. The HPV vaccine represents a groundbreaking achievement in public health, protecting against viruses that cause most cervical and several other cancers. Despite frequent concerns or misconceptions, research continues to show that the HPV vaccine is safe, highly effective, and offers powerful protection against multiple cancers. It's a remarkable opportunity to prevent suffering before it starts, and one of the most impactful tools we have to protect future generations. We've seen how the HPV vaccine helps prevent serious long-term diseases. Now, let's shift to a vaccine that protects us year after year, the flu vaccine. For more than 80 years, influenza vaccination has played a central role in efforts to reduce the burden of seasonal flu. The vaccine is updated each year based on global flu surveillance data, and it's designed to protect against the influenza A and B strains expected to spread during the upcoming season. Flu vaccine effectiveness varies each year, usually between 40 and 60%, but its benefits go far beyond preventing infection. The vaccine can make illness milder, reduce the risk of serious complications like pneumonia, and lower hospitalizations and death. For high-risk groups like older adults, pregnant people, and those with chronic conditions, it can be life-saving. Despite these benefits, flu vaccination rates remain suboptimal. Persistent myths and misconceptions continue to undermine public confidence and limit uptake. Let's take a closer look at some of the most common misconceptions about the flu vaccine. One common misconception is the belief that I never get the flu, so I don't need the vaccine. In the United States, about 5 to 10% of adults and children contract influenza each year. Even if someone hasn't had the flu recently, that doesn't mean they're immune or won't get it in the future. Because influenza viruses change from season to season, annual vaccination is the best way to stay protected. It's also important to remember that vaccination isn't just about individual protection. It's about community health. The flu vaccine helps prevent transmission to those at greatest risk of complications, including children, older adults, pregnant individuals, and people with weakened immune systems. Healthy individuals can spread the virus before symptoms appear, sometimes up to a day before getting sick, and continue to do so for nearly a week after. By getting vaccinated, we protect ourselves and reduce spread in the community, strengthening our collective defense against the flu. Another common misconception is that the flu is not that bad, or that young, healthy people don't need the vaccine. In reality, influenza can be unpredictable. Illness can range from mild to severe, and even healthy people can become seriously ill or die from the flu. Each year in the United States, influenza causes tens of millions of infections, millions of medical visits, hundreds of thousands of hospitalizations, and tens of thousands of deaths. While those with underlying conditions are at greater risk, no one is immune from potentially severe outcomes. Another frequent misconception is that the flu vaccine can give you the flu. This belief has no scientific basis. All injectable flu vaccines in the United States are either inactivated or recombinant, meaning they contain no live virus, so it's biologically impossible for them to cause influenza infection. The nasal spray vaccine does contain a live virus, but it has been weakened and adapted to replicate only in the cooler environment of nasal passages. It cannot reproduce in the warmer temperatures of the lungs or other parts of the body, and therefore cannot cause illness. Some people may experience mild side effects such as fatigue, low-grade fever, or soreness at the injection site. These are normal signs that the immune system is responding to the vaccine, not symptoms of infection. Communicating this distinction clearly is important, as confusion between immune response and illness is one of the leading reasons people hesitate to get vaccinated. Despite the facts, some patients still believe the flu vaccine gave them the flu because they became ill or test positive for influenza shortly after vaccination. There are several possible explanations for this. First, mild flu-like symptoms such as fatigue, muscle aches, and a low-grade fever can occur after vaccination. These are normal signs of the immune system responding and building protection, not the flu itself. Symptoms are typically mild and last only a day or two. Second, a person may have been exposed to the flu or another respiratory virus before getting vaccinated and before the vaccine had time to take effect. It takes about 2 weeks after vaccination to develop full protection. The flu shot does not prevent other viruses such as colds or RSV, which can cause similar symptoms. Third, in some seasons, the circulating influenza strains differ slightly from those included in the vaccine. Scientists select strains based on global surveillance, but the match is not always perfect. Even so, the vaccine still offers meaningful protection, especially against severe outcomes. If a patient is diagnosed with influenza shortly after vaccination, it's important to explain these possibilities and reassure them that the vaccine itself is not the cause of their illness. This often leads to another common question. Why do I need the flu vaccine every year? The answer is simple. Flu viruses are constantly changing, and immunity from vaccination or infection fades over time. Each year's vaccine is updated to match the strains most likely to circulate that season, providing the best possible protection. Scientists are also working toward developing a universal flu vaccine that could provide longer-lasting protection and potentially eliminate the need for annual shots in the future. Another common misconception is that the flu vaccine isn't effective, so it's not worth getting. It's true that flu vaccine effectiveness varies from year to year, depending on how well the vaccine strains match those in circulation and on individual factors like age and underlying health. Older adults and people with chronic illnesses may not mount as strong an immune response as younger, healthier individuals. However, even in years with moderate effectiveness, vaccination significantly reduces severe outcomes. During the 2023 to 2024 flu season, when effectiveness was estimated at 44%, the flu vaccine prevented roughly 9.8 million illnesses, 4.8 million medical visits, 118,000 hospitalizations, and nearly 8,000 deaths in the United States. Research consistently shows that vaccinated individuals who do get the flu experience milder illness, recover faster, and are less likely to require intensive care. For example, a 2021 study found that vaccinated adults hospitalized with the flu had a 26% lower risk of ICU admission and a 31% lower risk of death compared to unvaccinated patients. Similarly, a 2018 study in New Zealand found that vaccinated patients were 59% less likely to be admitted to the ICU and spent about 4 fewer days in the hospital. Beyond individual benefits, widespread vaccination reduces strain on the healthcare system, particularly during seasons when multiple respiratory viruses, such as COVID-19 and RSV, are circulating. The influenza vaccine isn't perfect, but it remains our best defense against flu infection and its complications. Providers can confidently assure patients that it is safe, well-studied, and highly beneficial, especially when received every year. In this video, we explored common concerns about both HPV and influenza vaccines. As healthcare providers, your role extends beyond understanding the evidence. It includes listening with empathy and communicating with clarity and confidence. Your recommendations matter. Study after study shows that a strong, trusted provider endorsement is the most powerful influence on a patient's decision to vaccinate. By staying informed, addressing questions openly, and leading by example, we can strengthen vaccine confidence, prevent illness, and protect the health of our communities.